Good afternoon, and welcome to the Arts and Health webinar on renewed moments for arts and healing, creating shifts and movements in policy, hosted by Americans for the Arts. I am April M. Harris, your facilitator for today. Thank you for attending today's webinar. We are excited to hear our presenters, two of whom are representing universities and one from a local arts agency. Dr. Brian M. Jenkins is with Project ReFocus at Howard University. Dr. Jill Sankey is with the Center for Arts and Medicine at the University of Florida. And Ms. Renee Anderson is with the Appalachian Artisan Center in Kentucky. What you can expect. Our presenters will respond to the overarching questions we have proposed. What are some practices and research that has surfaced in the field as a response to coping with public health issues? And two, what shifts in policy we can see as an impact? The objectives for this webinar include highlighting emerging practices and research from the field that address public health issues through the arts, and highlighting movements in policy and learning ways to advocate for the arts to continue making an impact in the well-being of our communities. Throughout the webinar, we ask that you use the Zoom Q&A for any questions you would like to pose to the presenters. During the Q&A portion, we will have them respond to as many questions as possible. So each of our presenters will discuss their work within the arts and health, and following their presentation, we'll share with you a call to action. Please meet our presenters in the order they will participate. Dr. Jill Sankey. Jill Sankey, PhD, is a Director of Research Initiatives in the Center for Arts and Medicine at the University of Florida, a Director of National Research and Impact for the One Nation, One Project initiative, and co-director of the Epi Arts Lab, a National Endowment for the Arts Research Lab in partnership with the University College London. She is an affiliated faculty member in the University of Florida School of Theater and Dance, the Norman Fixel Institute for Neurological Diseases, the Center for African Studies, and the STEM Translational Communication Center, and is an editorial board member for Health Promotion Practice Journey. Dr. Sankey served during the pandemic as a senior advisor to the U.S. Centers for Disease Control and Prevention, CDC, Vaccine Confidence and Demand Team on the COVID-19 Vaccine Confidence Task Force, and currently serves on the steering committee of the Jameel Arts and Health Lab, established by the World Health Organization, the Steinhardt School at New York University, Community Jameel, and Culture Runners. With 28 years of experience and leadership in the field of arts and health, and a PhD in arts and public health from Ulster University in Northern Ireland, Jill is active in research and policy advocacy nationally and internationally. She is an artist and a mixed methods researcher with a current focus on population-level health outcomes associated with arts and cultural participation, arts in public health, and the arts in health communication. She is the recipient of a New Forms Florida Fellowship Award, a State of Florida Individual Artist Fellowship Award, a NISOD Excellence in Teaching Award, a UF Internationalizing the Curriculum Award, a University of Florida Most Outstanding Service Learning Faculty Award, a University of Florida Public Health Champions Award, a University of Florida Cross-Campus Faculty Entrepreneur of the Year Award, and over 350 grants for her programs and research at the University of Florida. And Dr. Brian M. Jenkins. Brian M. Jenkins, PhD, is a cultural scholar who received his degree in communication, culture, and media studies from Howard University. Dr. Jenkins is a 2022 inductee into the Yale University Boucher Graduate Honor Society and has been recognized as a 2022 Rising Graduate Scholar by Diverse Issues in Higher Education. His research explores how marginalized groups educate and empower one another and find resiliency through both traditional and digital practices. His dissertation positions Black podcasts as a critical educational tool for Black communities that continues the traditions of Black orality and won the Broadcast Education Association's 2023 Kenneth Hardwood Outstanding Dissertation Award. Currently, Dr. Jenkins is serving as a postdoctoral researcher at Howard University for Project ReFocus, where he engages with communities about the importance of art as a coping and healing mechanism in response to a public health crisis. Dr. Jenkins is also a research fellow for Traditional Arts DC, a cultural heritage program that is to be a folk life center that focuses on people native to Washington, DC, primarily Black and Indigenous people. His work with Traditional Arts DC engages local communities and documents and amplifies the importance of their culture. Ms. Renee Anderson. Renee Anderson is a multidisciplinary artist from Paintsville, Kentucky. She is a 2020 graduate of Morehead State University, where she received a Bachelor of Arts in Art and Design and completed a minor in Arts Entrepreneurship. While in college, she was able to explore with her art and eventually settle into a focus in both ink, watercolor drawing, and photography. Outside of visual arts, it was arts entrepreneurship and arts administration that she discovered would be the career path she would want to pursue. Anderson now works as the artistic director and culture of recovery coordinator at the Appalachian Artisan Center in Hyman, Kentucky, where her goal is to help fight opioid use disorder through art. Renee is an exhibiting artist and with awards in drawing, photography, and painting. She has published in the 2021 installment of MSU's literary and art magazine, Inscape. She has worked on several public art projects, including a collaborative mural in Morehead's Don Greenhill Park titled Winged Animals of Kentucky. She completed 2 portions of the mural, The Big Brown Bat and the lettering design. Welcome to each of you. So, let's see. Apologies. Just taking a brief second here. So, we're going to get started, and we'll start with Dr. Sankey. Welcome.
Thank you so much, April. It's really a delight to be in conversation with you all tonight with Brian and Renee. I'm going to take a moment to share my slides, and I will get rolling. So I'm going to talk this evening. I'm in the UK where it is evening right now, so excuse me for the strange reference, but I'm going to talk this evening about social prescribing, and I'm going to begin that conversation with a little bit of background and orienting us around loneliness as a really significant public health issue in the United States today. But before I go there, I just have to begin by acknowledging that participation in the arts is a human behavior. We kind of refer to this as human art behavior, and we recognize that human beings have been participating in the arts and have been oriented toward the arts and have recognized the healing value for both individuals and communities throughout time and throughout history and across cultures. So we stand on the shoulders in all of the work that we do in the Center for Arts and Medicine of indigenous and traditional cultures whose knowledge and wisdom has a deep understanding of the relationships between the arts and health. And we understand that human art behavior is a thing that is innate in human beings. It doesn't mean that everyone loves participating in the arts, but it is a uniquely human behavior. And so this isn't a new thing that we talk about in this arena of arts and health, but it is a new thing in relation to biomedicine. So when we think about how we're driving uptake of the arts and recognizing the incredible work that artists and arts organizations are doing in relation to health of our individuals and communities, It is kind of new for biomedicine because we want public health, healthcare, biomedicine, really to have a uniquely different relationship today in a Western biomedical context than we have in some time. And so there is a deep understanding of the relationship between the arts and health that we build on. And we see it today, evident in the United States in healthcare and in other parts of the world, of course, but in healthcare through arts programs, surveys that were conducted more than a decade ago by the Joint Commission, the accreditation organization for healthcare institutions in the US, have shown that about half of healthcare institutions in the United States today have arts programs. And so we see artists working as employees in healthcare. We also are seeing, as the field advances, evidence-based clinical interventions in healthcare and in public health. And in the realm of public health, we see, again, more and more interest in and uptake of the arts for prevention and disease management, for health communication, and we're seeing this relatively new arena of social prescribing in the United States following global trends today. And that's what I'm going to unpack a little more of today. So why is all this interest happening? Not only do we just know this as human beings, but we now have a pretty robust evidence base that helps us understand at the population level how participation in the arts can benefit health. For instance, research is showing that people who participate regularly in the arts are less likely to develop depression or have lower risk for depression. In the UK, longitudinal statistical studies have shown a 48% lower risk of depression. Our studies, statistical studies in the United States, have shown that people who participate in the arts just once a month or more, who are over the age of 50, are 20% less likely to become depressed. We also see associations across the world and in the United States between arts participation and healthy aging. And many large cohort studies now have shown that at the population level, people who participate in the arts are less likely to die early, between 14 and 31% less likely to die early in different parts of the world. And all of these kinds of epidemiological population level studies are really highly controlled for the things you might be thinking of, like socioeconomics, geography, age, gender, those sorts of things. And so with the mortality studies in particular, these benefits are attributed toward the immune benefits of arts participation. At the individual level, we see from the evidence base things like dance providing even greater benefits than exercise to Parkinson's disease symptoms and management. We see that music can be very impactful at reducing the perception of pain. And we see that dance can have even greater benefits around cardiovascular disease prevention and management than walking. So we have a robust evidence base now that's driving this greater uptake of the arts in both public health and healthcare. And in our work at the University of Florida, much of our research today is based on the premise, our belief that arts participation is a health behavior. And in fact, this statement comes from our research and other research in the field. We also contend that access to the arts is a social driver or determinant of health, because we know that people who have more access to the arts and who participate more in the arts can have better health outcomes. And so in that way, access to the arts is absolutely a social driver of health. And we're thinking a lot today about loneliness. We focus our work around 5 key issues, among them collective trauma, racism, mental health, social exclusion and isolation, and chronic disease. Those are the some of the big public health issues that we're focused on now, and around which we feel the arts can make particularly important and impactful contributions. And loneliness, as we're becoming more aware today, is an epidemic in the United States. If you haven't seen it yet, the Surgeon General not long ago published a report on loneliness in the United States, noting in that report that as a health risk, in particular a cardiovascular health risk, loneliness is a greater risk than obesity or inactivity. And it's equivalent to smoking 15 cigarettes a day as a cardiovascular risk. It's also true in the United States now that about half of adults, a little more than half of adults, are experiencing loneliness, and 1 in 7 men in the US reports not having even one friend. So loneliness since the pandemic, and as we move into things like AI technology changing the ways in which we interact, is a very serious epidemic and health risk today in the United States. So that's at the heart of a lot of the work that we're doing in our Epi Arts Lab. The Epi Arts Lab at the University of Florida is a National Endowment for the Arts Research Lab in partnership also with Bloomberg Philanthropies and the Pab Steinmetz Foundation, Americans for the Arts, and University College London. And so in this lab, we do epidemiological population level studies looking at health outcomes related to various forms of arts participation in the United States. We also are very focused on advancing social prescribing research, policy, and practice in the United States. And I'm going to unpack what social prescribing is in just a minute. But before I do that, I'll share just a few of our recent research findings that are linked to this work that we're doing around social prescribing. So we use 7 longitudinal large cohort data sets, and we do statistical analyses of these data sets with our partners at University College London. And in one of our studies, looking at child development and adolescent groups, we found that doing just 1 or more school-based arts activities was associated with 59% higher odds of reporting high social support, right? And that doing arts activities in particular was associated with 28% higher odds of reporting high social support a year later. And again, these studies are highly controlled for other variables. We find we look a lot at older adults and arts participation. And as I noted earlier, we've found that compared to those who don't spend time on hobbies and projects, those who do are 19 to 20% have 19 to 20% lower odds of developing depression. And those who participate in creative activities just once a month or more are 20% less likely to be depressed. So we see protective effects potentially of arts participation around depression and other mental health conditions. Similarly, we find that creative activities are closely linked to self-reported healthy aging. And that means the absence of chronic disease and the presence of high levels of cognitive well-being and general well-being. So we see strong associations in the United States and around the world between arts participation of all sorts, not just going to performances and galleries, but participating in the arts at home as well. And so this is one of the arenas of research that is influencing a big growth in social prescribing around the world. So social prescribing is a system wherein health providers and others can prescribe or refer patients to community-based non-clinical activities to improve health and well-being. So it's a prevention approach, and it's really a co-creation of health. It's a way of even empowering patients to make decisions themselves about their health and to connect with resources outside of the medical system that can help generate health and prevent the need for medical interventions. So social prescribing has been policy here in the UK for more than a decade, with link workers, about 2,000 link workers working in these programs around the country. We're seeing social prescribing in about 30 countries around the world. And in the United States, we also are seeing more than 30 programs. We just finished our 23rd case study of social prescribing programs in the United States. And as researchers are looking at these programs, they're seeing that by referring patients to very local arts, cultural, nature, social, volunteering experiences, that psychological well-being, quality of life, mental and physical health are being improved, and things like loneliness, isolation, anxiety, and burden on primary care systems are being reduced. And we're seeing cost savings as well for our healthcare systems. And so now we're seeing social prescribing programs proliferating. We're also seeing sort of a subset of programs called Arts on Prescription that are focused on the referral of people to local arts and cultural resources in particular. So we see beautiful partnerships between cultural institutions and healthcare and public health systems that are allowing people greater access to the arts to benefit health and well-being. I also want to note that this is just one way in which people can access the arts, right? A lot of our work is focused on communications that will help us in the United States reach a paradigm shift in which we generally recognize that the arts are good for us, like we recognize that exercising is important to our health and eating well and wearing seatbelts and not smoking, that we just collectively recognize the health value of the arts, and more people then are able to seek out the arts. And of course, in this proposition, we need to really address access and equity in the arts. So we have a lot of work to do in this arena in the United States. So we're doing research that's designed to enable a high quality of research in this field, which in turn can drive policy and investment in not only social prescribing, but in the arts, in the work that artists do in their communities, so that American citizens have greater access to the arts. So I mentioned our case study. We're creating core outcome sets to drive the ability for research to be synthesized into things like systematic reviews and meta-analyses. We're doing implementation science studies of social prescribing right now. This is the "if we build it, will they come" study. How do people feel about it? Is it acceptable? Will people do it? And we've developed a set of key common outcomes for social prescribing research as well. So I want to just close with pointing you quickly, and you will receive the slides. So pointing you quickly to some resources that you can link when you receive the slides through the QR codes. This is one of our outcome studies with Tasha Golden and Mass Cultural Council. We developed this beautiful Arts on Prescription field guide. So this is a how-to guide looking a lot at health equity and how social prescribing can contribute to health equity in the United States, and the World Health Organization's toolkit as well. So those 4 resources are there for you all to access after the webinar. Thank you so much, April.
Thank you, Jill. Really appreciate that. Just to remind folks that we do have a Q&A open for you. So if you have any questions, please put that in the Q&A. And if we have an opportunity, we will have our presenters respond as soon as we are finished. So now we're going to move forward and go with Dr. Jenkins. So welcome.
Thank you so much, Ms. Harris, and I'm excited to be able to speak with you all today. So let me go ahead and share my slides. All right. So good afternoon, everyone. So I want to talk with you all today just a little bit about Project ReFocus and the work that we're engaging with around the arts and health. And first, I just want to briefly acknowledge the funders of our project, the CDC Foundation, for their support, as well as our project partners. And we have 6 partnered cities along with Project ReFocus. So I also want to briefly just recognize them, and then also recognize the co-founders and leads of Project ReFocus. So this is a joint project between the UCLA Center for Social Justice, Racism, and Health, and Dr. Chandra Ford, who was the former director of that center, currently is a professor of behavioral social health and education sciences and African American studies at Emory University. And then also the other co-lead are Dr. Monica Ponder, who is assistant professor of health communication and culture at Howard University. And so to very briefly kind of provide an overview of Project ReFocus and all that we are doing and aim to do. So ReFocus stands for Racial Ethnic Framing of Community-Informed and Unifying Surveillance. And so what Project ReFocus is really about is making crisis communication more community-centered and led. And so a central truth that we operate under is that racism is a public health crisis, and marginalized communities who are the most vulnerable within the crises are often facing multiple crises at a time. And so we're always we're interested in saying what happens when the crisis doesn't stop for some people, right? So how do we make crisis communication better and more tailored to these communities? And we recognize that public health practitioners need tools and resources in order to better communicate to and serve these communities. And so in order to address this at Project ReFocus, we're instituting a number of different methods, one being the incorporation of a crisis stigma monitoring and response system, which would be taking data inputs from the communities in order to better track the different stigma and health issues that they're dealing with in order to be fed into a response from crisis communication teams and health departments and et cetera. We're also within our 6 partner cities, we have partner organizations that we're providing supports to lead their own projects, to engage their communities in ways that they see valuable, and also engaging with minority press outlets and journalists and evaluating the important role that they take within the midst of a crisis, especially when it comes to communicating with marginalized communities, and how can we better leverage them going forward and provide them with the supports they need. And then, of course, lastly, what we're talking about here today is we're really looking into the role of the arts and health and the role that it can take within a crisis response. And so I won't go too much to repeat what Dr. Sankey just said in terms of the research around the arts and health and its importance and its benefits for individual health. And then, of course, also with community health on a communal level, which is really what ReFocus, we're really focused on. Research shows that community arts projects promote social cohesion. And so helping community members feel more connected with each other, building and strengthening bonds, making people feel a little more beholden to each other, combating loneliness, which is we just learned is its own health epidemic as well. And community arts projects, especially when it's centered at addressing a specific issue, whether that's issues of race or ability or mental health, it helps other community members who might originally be thinking that is an issue that some other people are dealing with, helps reframe it so that they are looking at it as, no, this is an issue that's plaguing my community and I need to step up and help address this issue. And so the research also shows that communities that are well-funded in the arts tend to be stronger and healthier communities than those who are not, and stronger and healthier communities respond better to a crisis, which is really why we're interested in exploring how can relationships between artists and public health institutions be strengthened? How can we incorporate better arts-based initiatives in the crisis response? And so this is really, our sort of our first study and foray into this realm. And so what we did initially was with our partner cities, Lincoln, Arkansas, Albany, Georgia, Detroit, Michigan, the Bronx, Wake County, North Carolina, and San Antonio, Texas, we conducted an ethnographic study by going into our partner cities just to primarily speak with artists, primarily marginalized artists, to examine the environment and get a sense of the cultural and political context, and just garner an understanding of what the community art scenes looks like and what kind of connections they have within the health sectors and also within local governments, and just really understanding this better. And so a few lessons that were learned from this initial study is the first, feeling removed from the arts. So on one level, this is a semantics, a language issue in terms of when we say the arts to people, people kind of think of a more narrow view of museums and theaters and such, but really wanted to know that we're encompassing and talking about multiple levels. So that could even be cooking and gardening, whatever kind of cultural expression that you feel you have. So there's one level that is the semantics and maybe changing the language with engaging with communities, but there's also a more racial undertone and connection to it, which I'll speak about a little bit more in funding inequities, but just to provide an example, in one of our cities, there is this, I should say, longstanding historical Black cultural arts center that has hosted and held concerts and shows from jazz lessons such as Dizzy Gillespie to people like Sheila E., more recently like a Gregory Porter. and that has been in this community for at least 60 years. And when talking with one of the directors over the organization, they mentioned how, or the center, I should say, they mentioned how the city's official arts and cultural page just added them in 2022, maybe 2021, just added them to the list of these are like our cultural and arts, or one of our cultural and arts organizations for people to engage with. So there's really also this level of disconnect there from what people consider the arts that's maybe a little more structural. And the next lesson, loose ties between the arts and health. So when speaking with people and just asking them in general how they think about the connections between these two sectors, while many people, especially artists, could understand the more personal level of producing their art and how it helps benefit them, and it's their own form of therapy in the sense of something that I heard a lot. But in general, a lot of people didn't have a very strong connection in thinking about all the benefits that are there. And then on a more institutional level, while there were some exceptions at large, there were not many institutions in these sectors that were really combining and working at the intersections. But from those those organizations and folks that we did find that are working explicitly within the intersection of art and health, what we learned from them is that they are a minority within that space, and also that it's a bit of an uphill battle and they're still struggling for support. So from organizations that put artists within hospital systems are saying that it's difficult to get hospital execs to support this work, and they don't see a value in it. And then on another level of licensed health professionals, mental health professionals who try to work and partner with arts institutions, stating that it's a bit of a uphill battle for them too, and that these institutions are not necessarily comfortable with working with professional health practitioners. And so there's still work to be done there. And then art building community. So as the research suggests, is that art is a benefit on a communal level and helping to uplift communities. And so this is what we found a lot of, especially from marginalized artists who are already operating at the margins of the particular communities and cities that they live within and aren't necessarily receiving the most support. And so what we found several examples of are those artists who were able to be afforded to have some sort of studio space or storefront or some other kind of space, is that they use that space to really uplift those around them. So holding block parties and other community events, putting other artists, not just their own, but other artists' work for display and on sale. Also hosting their space for grassroots organizations to use for meetings and events, and even creating, in one example, finding that one organization was working to create a co-working space to bring together both artists and entrepreneurs to be able to work. So take the creative mind and the business mind for people to come together and help uplift each other. And then from the last lesson in terms of funding inequities, so much just like, especially within the US, historically, there's plenty of examples of inequity in funding across many sectors, education, health, and so forth. The arts is no exception. And while this study didn't go yet into more of a direct examination of how the art funding within these cities is being distributed, from the conversations with artists and arts organizations, it suggests that there might be some inequity there. So, for example, in one of the same cities, speaking with a white-owned, arts organization about what kind of support they receive from the larger arts institutions in the city as a whole, it's a completely different story when you talk to the Black-ran organizations who don't feel that they have any support level. And mentioned that maybe in the summer 2020, they received some interest and support, but then that went away. And then they really only get support maybe around a holiday like Juneteenth, and then they won't hear anything till the next Juneteenth. And so just to wrap, what we are working on doing from these lessons learned and from this study and more going forward is to develop policy recommendations to be presented to our funders. So three that we're working with now is more promotion of the arts connection to the health. So definitely the calling for more funding to support more research in this space, and then being able to get this information out to both the general public and also support programs to support the general public, but also getting more information out to health practitioners as well. And then more equitable funding of the arts. So as the research suggests, communities that are better funded in the arts are in stronger, healthier, and in a better situation to respond to a crisis, an ongoing crisis they're dealing with, and plus any other new one that may occur, whether it's a viral pandemic or some sort of natural disaster. So we want to make sure that these communities are also funded properly and able to benefit from having great arts programs within their communities, and then also funding cultural barriers. So, and this speaks a lot directly to direct crisis communication and making sure that in the midst of a crisis, when you're dealing with marginalized communities who already have a lack of trust within larger institutions, both health and government-wise, you want to make sure that you're able to have effective communication to them and in order to better service them. And so one way to do this, artists are already within their communities, very trusted and already delivering messaging to their people and working within them. So let's fund and rely on them better to help get that information out. And so I'll end there. So thank you all. I'll just say follow projectrefocus.com just for more work as we continue on. Thank you.
Thank you, Brian. Appreciate you sharing that information with us. Now we'll move on to Renee Anderson.
Thank you, April. So like April said at the beginning, my name is Renee Anderson. I am the Artistic Director at the Appalachian Artisan Center. And bear with me because I had some issues. So Heather is running my slides for me. But so you can go ahead and skip to the next slide. So I'm going to be talking about our Culture of Recovery program and the ways that we have implemented our art to help the issues that we have in the area. So we're located in Hyman, Kentucky, and it began a little bit before 2000, but was founded in 2000. And we have retail consignment gallery where we have works from over 300 artists from the area, and it's a juried process where they go in, submit their work, and actually go through the jurying process to be submitted and sell their work. And we have incubator studios where artists are able to kind of get their feet on the ground, and they get, sorry about that. But so they are able to pay a very minimal price. One studio is $75 a month, and it's a way for artists to kind of get their foot on the ground while they're emerging and getting a fresh start. And we have 4 state-of-the-art studios in ceramics, blacksmithing, weaving, and the Appalachian School of Luthery. You can go to the next one. So our main problem in our region is heroin and fentanyl and other dangerous drugs, and they are increasingly available on the Kentucky streets with deadly consequences. Abuse of these deadly drugs is not limited to any specific socioeconomic group. The increase of opioid use fuels violent crime in our communities, stresses our social services network, burdens our healthcare system, and reaches into our schools. Most of all, it's devastating Kentucky families and robbing us of our promise and potential of thousands of citizens who are enslaved by addiction. In 2022, 2,135 Kentuckians lost their life to drug overdose. That is a decline of more than 5% compared to the previous year, which was the first decline since 2018. So this is a quote from Governor Andy Beshear, where he said, "Seeing a decrease in overdose deaths is encouraging, but we still have a long way to go because one Kentucky life lost to overdose is one too many." So our solution to this problem that we have in our area is our Culture of Recovery program. So this program started because of one man came into our School of Luthery, which is where we build and host workshops for building string instruments. And he was very adamant about wanting to start a apprenticeship, but because of rules that we had at the time, we can actually switch the next slide for this, but because of rules that we had at the time, he wasn't eligible to be part of the apprenticeship. And there was this realization that there were people in the area who could really benefit from what we do. And because of that one man, Culture of Recovery started. And it was generously funded by Art Place America in the beginning, and has grown into a program that we have weaved into all of our grants and has been very impactful for our area. So, Culture of Recovery is now a nationally recognized program that partners with the Knott County Drug Court and local recovery centers. We offer hands-on workshops in ceramics, lutherie, blacksmithing, and sometimes we'll do painting and printmaking and stuff like that. And Knott County Drug Court will often send over their clients to get in community service hours where they will either clean or do office work, and that might also sometimes involve building instruments. Hundreds of clients have gone through Culture Recovery program and have gained skills they never knew that they could have, as well as useful life skills and the importance of friendship and accountability. Culture of Recovery led to the opening of the Troublesome Creek String Instrument Company, which is under the umbrella of the Appalachian Artisan Center. The main goal was to hire members from the recovery community and lay off coal miners. This is a picture of a couple of our luthiers. So Jeremy is on the right, and these two have been with us for the longest time, and along with a couple others, but they have been there pretty much since the beginning. Jeremy came from the recovery center, and Chris actually is not from recovery. He joined because he was a delivery driver and he loved what we did, and we've kept him close ever since. So he is really great for the guys that are there, really great accountability for all of them. So the Troublesome Creek Instrument Company is, it started out of the School of Luthery, but now we are building fine instruments using the best materials and people in the world. While deeply rooted in ancient musical traditions of the hills, our work is driven by the belief that an individual can take recovery into his or her own hands and to build something beautiful. Since CORE began in 2018, we have instructed hundreds of individuals, offering them new focus and healing. And of these many success stories, an especially talented select group have gone on to become luthiers at TISIC. And we're extremely happy about that. At the moment, there are about 15 employees who all came from addiction recovery. So this comes from our blacksmithing program, and it is a large anvil that is about 5 or 6 feet tall. And a little bit about it is, it's called From Genesis, well, it's Ring in Remembrance, but from Genesis to infinity, metalsmiths have forged the door to the future while leaving windows to our past. This anvil stands as tall and strong as the people of the mountains. The ingenuity and creativity of our people sings through these hollers like the ringing of a bell. This anvil statue was completely built by Culture of Recovery clients with the guidance of Master Blacksmith Dan Eastep. Then I have a couple of pictures of the process of it being made, and you can see just how large this is in comparison to a grown man. So it was, obviously we had some guidance from Dan for this, but it was completely built by members of the recovery community. And it's something great for them to be able to look at and see that that's something that they were able to do while in recovery. So next up is Anthony Carter. He is one of our most well-known success stories from outside of building instruments. So Anthony is a fiber artist from Carter County, Kentucky, and he began his journey as a weaver while in a drug treatment program in 2020. He's a cultural recovery program graduate at the Appalachian Artisan Center, where he was introduced to his mentor and master weaver, Bob Young. Anthony has begun teaching his own weaving workshops as a way of giving back to the programs that helped him through his own recovery. Healing through the arts has become extremely important to him, and he has made it his goal to carry that with him and pass on what he has learned to others while they are making their own way through recovery. And then I believe this is my last slide, but it is a photo. We are coming up on 2 years since a bad flood came through our area, and the Appalachian Artisan Center has 4 buildings, and all 4 of them were pretty much completely wiped out, other than our blacksmith studio, which was upstairs in the string instrument company, and our store. But this photo is of our School of Luthery, and it shows some of the guys from the recovery center helping clean up. And it was kind of a little bit of a switch, because these are the people that we help every day, and they were extremely eager whenever we came in to give back and help us in the recovery that we had to do. So it was a little bit of a switch. They knew that they couldn't make art at the moment, but they kind of ended up giving back to us in the end, and they were just simply light in the darkness. And some of our cultural recovery clients have been called the Heart of Hyman, and that is extremely true. So thank you guys so much. Well, yeah, I have a couple pictures on there, but thank you guys so much. I have some tags there where you can find us on social media. That's for the Artisan Center, and we have a separate account for our cultural recovery program and our string instrument company. So thank you guys so much.
Excellent. Thank you, Renee. Thank you all 3. I know we're running a little bit behind, but we're going to at least ask one question for discussion. And so hopefully we'll have about 5 minutes or so to answer this one question. So the question is focusing on research to practice, basically. So each of you talked about and have expressed what some of the what you found. So just wanted to kind of get a sense from you what you think about in terms of your work and how we move from research to practice. And if I can actually get the question, I'd be able to give you exactly what I'm talking about. So give me a second here. So the question really is, what communication strategies are best when moving from research to practice, to community practice? So any of you are open to answer this question?
I'll be happy to get us started. I mean, I think it's important to think sort of holistically in this regard. You know, often when we have compelling research, we want to, you know, drive at policy really quickly. And that can be great and really important opportunity. But I think it's really important to think about, you know, who is the research for, who can it benefit? And, you know, as we move from research to practice, making sure that we're enabling the sectors. I loved, Brian, you talked so beautifully about, you know, cross-sector collaboration and engagement. And, you know, how do we need to bring sectors together to consider how research can best be applied, right, where it's needed. So to think holistically, I think, is really important, especially as we're considering policy.
Excellent.
And to just add to that a little bit is, I think, definitely listening to community. So if you're working directly with a set community or communities, really taking the time to understand what is their interest. So not trying to force too much of your vision onto them, and really understanding, and then also leveraging the research and maybe whatever, you know, if you can, funding that comes along with that to help fund projects for them to do and lead on their own. So kind of using our cultural cachet in this space that's usually able to, you know, withdraw extra funds and such that and support that, you know, maybe your average community member can't. So using that to help support their visions.
Great. Renee, would you like to tackle that question as well?
Yeah, I just want to say that, like, I think for something like this, I think you just need to have one person who believes in what you're trying to do. I know it's been said before that whenever our culture of recovery program was proposed, she might actually be in here, but the drug court director at the time said that whenever it was first proposed, she was like, this isn't going to work. This is not going to work. And then now here we are several years later, and you see how effective it actually has been. So it's just giving that pitch and getting someone to believe in you to move forward.
Excellent. Well, I wish we had more time, and unfortunately we don't, but I do want to say to each of the presenters, thank you for sharing your insights, thoughts, and experiences with us. Thank you to our audience for participating in today's webinar. This webinar has been recorded and will be available within the next week. I also want to thank the AFTA team who has provided support through the process: Mital Lyons-Warren, Gigi Bond, Heather Flanagan, and Mandy Lee. And you will notice in the Q&A section, there is a call to action from each of the presenters today. So we ask that you look at what they have there. There's some links as well. And we also, AFTA has a call to action. We are going to have another conversation on arts and health community dialogue on June 11th, 2024. And so you'll be receiving an invite, and we ask that you register for this conversation. So again, take a look at all the calls to actions, as we're looking forward to having you participate and learn more about arts and health. And again, thank you all and have a good afternoon.